So what we need to do, really and truthfully, is we need to be proactive. We need to educate ourselves. And the reason I'm here to tell you that is because the people who are educating your doctors are people just like me, like I was. They are people that have an economic vested interest to keep you as customers in their back pocket. So they're not going to be likely to give you a whole lot of good information, okay? Because they want you to be addicted to their drugs. They want you to be a lifelong customer. And if you don't believe that, then tell me how many people in here are on cholesterol-lowering drugs? See, we got a few hands that go up in the audience, and that's because a lot of you are under chiropractic care that you probably aren't that many of you on cholesterol-lowering drugs. But they've got all of us buying into this ridiculous information that cholesterol causes heart attacks. Guess what? As a pharmaceutical rep that called on cardiology and has also called on some of the doctors from Harvard and some of the best-known researchers that there are, that theory was debunked 15 years ago. They know that cholesterol isn't what causes heart attacks, but as long as they're making billions of dollars off of cholesterol-lowering drugs, they are going to sell them to you, and they are going to convince you that you have to take a drug to be healthy. But they taught me, as the rep selling the drugs, that, hey, guess what? You can lower cholesterol too much. And if you do that, you can wreak havoc in every other body system that you have. In fact, all of the clinical data shows that people with lower cholesterol levels, especially those over the age of 55, if they have lower cholesterol levels, they will die of other things such as cancer, autoimmune disorder. They can also have severe impotence. Well, they won't die from impotence, but it might be a major imposition on them. And that is one of the major side effects that we're seeing with the cholesterol-lowering drugs, is impotence. Neuropathy is another one. Amnesia, another one. Alzheimer's. So do you see what we're doing? The pharmaceutical industry is creating add-on business for themselves, because these drugs create other disease states that will require additional pharmaceuticals that you'll have to take. Let's take the cholesterol drugs, for example. Does anybody know what the #1 cholesterol-lowering drug is right now that's on the market? It's called Lipitor, okay? Now, the same manufacturer that makes Lipitor, their #2 selling drug is Viagra. Hey!